It's time for another edition of Sports Insider, brought to you by Faith Regional Health Services. I'm News Channel Nebraska's Chris Whitney, and before we get to the action, we're joined once again by Erin Baumert, physical therapist with Faith Regional Rehabilitation Therapies. Erin, thanks so much for joining us again.
Thank you for having me.
Now, there's a high concern with reducing bone density as we age, as people learn about the risks of osteoporosis, but what can be done throughout one's life to reduce those risks? Specifically, what are the goals and guidelines for young adults?
Throughout our lives, there's the increasing risk as we age for decreasing bone mass density, and we can start as early as young adult, adolescent to help decrease that risk. Some of the activities that can increase your bone mass when you're younger are higher or moderate to higher impact activities, higher intensity activities with increased loading forces, plyometrics, gymnastics, sports that involve running and jumping such as soccer or basketball and those kinds of things throughout that adolescent period of your life can help increase the mineral accrual in the children's bones. There's also evidence that shows that increasing your bone mass in that stage of your life can carry over into adulthood. So those physically active habits can increase your health into adulthood. We recommend that that age group is getting at least 3 days a week of that type of activity for about 10 or 20 minutes per time.
What are then the goals or guidelines for adults now that we've talked about young adults?
The primary goal for adults is maintaining the bone mass density, not as much as increasing that into adulthood as much as we try to maintain it. Activities that we can do to maintain it include weight-bearing exercises such as walking, jogging, stair climbing, but these gains in bone mass density are not maintained if the exercises are discontinued. So you want to make sure that you keep doing that to help decrease your risk for fracture and decreasing that bone mass density.
Certainly. Then, so how long and for what duration are we talking about doing some of these activities to help keep bone mass up?
We want to encourage people to keep these up for 3 to 5 times a week. For the endurance activities and resistance training, weight type training, we're doing 2 to 3 times a week for a combination of about 30 to 60 minutes a day for the two.
Certainly. Erin Baumert with Faith Regional Rehabilitation Therapies, thank you so much for joining us once again.
Thank you.
That's another edition of Sports Insider, brought to you by Faith Regional Health Services. At News Channel Nebraska, I'm Chris Whitney.